Today's topic, blood infections and how serious they are in sickle cell disease. So a few days back, we talked about why a simple fever can actually signify something potentially life-threatening in the world of sickle cell. Today, we're going to talk about what exactly a blood infection is and how people living with sickle cell receive treatment for that. So a blood infection is when a typical bacterial infection in your body is not stopped during the first presentation. So let's give an example. I have a respiratory infection like pneumonia, and instead of my body being able to combat it within my lungs and kill it off then, it travels into my bloodstream and stages a takeover. Blood infections are very serious and they require very high level IV or intravenous drugs that go directly into your blood system. You and I are used to taking pills by mouth or doing like an inhaler for pneumonia. However, once something reaches a blood infection level, you have to have your medication given through an IV. So the way that you're able to tell if you have a blood infection in the world of sickle cell is oftentimes the only presentation is a simple low-grade 101 fever. Anytime you have this, it's urgent that you immediately go to the hospital, whether it be to clinic if they're open or to the emergency room without any medication, because that can actually hide the infection when they're doing the labs. They will take out some blood and put them in these little glass tubes, and they will do what's called a culture. And a culture is they mix your blood with some other chemicals and then they watch it for typically at least 24 to 48 hours. Most major bacteria that like staph infection or pneumococcal, things that are incredibly serious, will grow within those 24 to 48 hours. And during that time, they give you what they call broad spectrum antibiotics, which is something like ceftriaxone that will kill most of the common blood infection bacteria that we're used to seeing. So if you do, in fact, or your loved one does, in fact, have a blood infection, what will happen is they will get something called a PICC line. And a PICC line is like an IV, but instead of going just in your hand, it actually goes up here in your arm and goes all the way down into your heart. So when you receive the medication, it goes straight into your bloodstream as fast as possible so that your body can have that help to fight off the infection quickly. In children, a PICC line is inserted under anesthesia because they can't move, and there is the possibility of hitting a nerve, which is extremely painful. That's actually happened to Thea twice, where in PICC line insertion, they've accidentally hit a nerve up here, causing extreme pain. Now, it's easily rectified. They just pull it back a little bit off that nerve. But if you've ever had nerve pain, you know how excruciating that can be. In adults and older teenagers, the PICC line can be inserted just while you're awake next to your bedside. So you receive this PICC line and then you get, they try to give you targeted antibiotics through that IV, and you are not allowed to go home until you test negative for that original bacteria. And sometimes this can take a week, depending on how many different medications they have to try and how resistant the bacteria is to those medications. Once you go home, you keep the PICC line in and you receive those IV meds from a nurse or a trained loved one. Sean is actually certified to do this in our house so that we don't have to have a bunch of nurses coming. And you receive those IV treatments usually twice a day for a couple of weeks. Then you go back to the hospital, get retested for that bacteria again, and if it's negative, the PICC line comes out and we move on. If it's positive, they try another type of antibiotic and you start the whole process over again. Blood infections are very serious and it's important to get any fever checked out. Stay tuned as we move on. We're nearing World Sickle Cell Day coming up here. It's tomorrow. And we'll just continue on for the rest of the month of July. Thanks so much for supporting us. Check us out on the web at hopeforscd.org and post any comments or questions below.